Have you been told that neck pain and lower back pain, shoulder pain, is just all part of aging? You know what? That does not have to be true. Not at all. Today, I am very excited to introduce to you one of my favorite people. He's been a doctor of chiropractic for over 28 years. His patients, his peers, and of course myself, we all see him as the spine expert, particularly with disc disease. So, hey, listen, come on in, pull up a chair, and let's learn a little bit from Dr. Leo as we kind of go over the basics of spinal health, preventative care, and what you might be looking for to take care of your spine.
My name is Dr. Leo Boisvert. I'm a chiropractor, been in practice for 28 years, and we're hoping with this video series, this is just the first of hopefully many, that people don't have to believe that neck, mid-back, and low back pain are in fact inevitable, or that there's nothing that can be done to prevent it or combat it when it strikes.
Right. Okay. So we're just going to cover the basics. So let's just start with the basics. We've got our spine here. So
Sure.
Tell us about the spine. What does it do? The disc. Kind of give us an overview.
Yeah, an overview would be, if this is the human spine, the spine is a flexible column of bone, right? The flexible part, very important. If there weren't flexibility, we would all walk around if it was a solid column of bone, we would all walk around and be unable to move very well. We wouldn't be able to bend over, bend left, bend right, turn our heads. So it's a flexible column of bone designed to protect the very sensitive spinal cord and provide a pathway for, the brain to be able to communicate with the rest of the body. The flexibility is key though, right? Protects the spinal cord, gives mobility or flexibility to that person. So it's known as the axial skeleton, and it's the primary thing we do as chiropractors.
Okay, and in our practice, we get a lot of disc injuries. It's kind of what your specialty is. So tell us about the disc. How is it supposed to function?
Yeah, so the discs, you have, discs are really ligaments, and ligaments hold joints or they hold bones together, whereas tendons act on bones. Like my deltoid muscle blends eventually into a tendon, and it acts on my humerus so that I can abduct my arm. Ligaments, and discs are ligaments, they hold bones together. And so in the spine, you're born, you have well hydrated, you have 24 freely movable vertebrae. 23 of those have discs between them, and the disc is it serves as a shock absorber. It's a fibrocartilaginous pad or ligament between two vertebrae. It has two principal parts, the tougher outer part called the annulus fibrosus, and the more liquidy inner part called the nucleus pulposus. And when you're young, this disc has a blood supply. When you reach skeletal maturity, more or less around that area, that blood supply atrophies away, and blood is no longer brought to the discs. So there's a lot of people walking around, in their 20s, 30s, and 40s that look more like this. And that looks fine when you look at it by itself. Still have the annular fibers surrounding the nucleus pulposus. But if I hold it up next to the original, the fully hydrated, fully healthy disc, you can see these discs are thinner. And if you look real close, I'm hoping we can zoom in here. These annular fibers are breaking down. They're starting to dry out, whereas these are still concentric rings around the nucleus. So this person has the beginning, if you will, of disc degeneration or disc wear and tear. A lot of the patients we wind up seeing, they wait until they have symptoms, and that would be more like a disc like this. So this disc is even thinner. Osteophytes or bone spurs have begun to form. If you look at it this way, the annular fibers, the outer ring of fibers around the disc, around the nucleus rather, have really started breaking down. They're showing you here with the color change that the water content of that nuclear material, that nucleus pulposus, has changed dramatically. And if you look real close, you can see it's begun migrating towards this back, in this case, left corner of the person's low back. So okay. That is what can happen to discs. And this model just shows the person has really no disc left at all. It's literally bone on bone. And these folks come in and we still help them, but We like them when they come in somewhere between here and here. We like it better because we can do more for that patient.
Right. Okay. So we're going to talk a little bit about, before we get into the diseases and the different types of what can go wrong, let's talk about how we can keep it from going wrong. So what are some things that we can do today if we don't have any disc injury? What's something that we could do today that would prevent any of this bad stuff happening?
So, I mean, this will sound, I don't know, corny or comical, but as a chiropractor, I can tell you the number one thing is to see a chiropractor, at least, not just when you're hurting, but at least on a somewhat regular basis. You may or may not be aware that the pedia chiropractic movement has taken off. I remember when I first started practice, pedia dentistry was not where it is today. It was out there, but it hadn't built the momentum that it has here in 2025. Pedia chiropractic, likewise, there are chiropractors who specialize in treating children, and that's all they do. I remember hearing about pedia dentistry, probably like in 1995 or so, and I said to whoever told me, I said, do you mean that if I went into a pedia dentist, they would refuse to see me? And they said, yes, you're not a pediatric patient. They limit their practice from newborns to age 18, and that's it. So that specialty also exists in chiropractic. But I think if we could teach America to take a regular adjustment to their spine before they have pain, that would be a huge thing that would prevent this what people think of as inevitable wear and tear in the spine. It's not as inevitable as people think. So another thing we could do is we could drink more water. And I'm not in the camp that says you have to drink gallons of water per day. But on the other hand, you are a largely, your body is made a huge percentage, whatever it is, 90% of water. Water is everywhere in your body, including even in something like intervertebral discs, as we talked about earlier. So a good amount of water, 4, 6, 8 glasses a day, something in there, not so that you're living in the restroom, but so that you're regularly at least sipping on water. That goes towards total health, but certainly towards spinal health as well.
Right. And I know that a lot of times people will, when we go to the gym, and you'll see people just guzzling this water. But the best way to do it is just to sip on it throughout the day. That way you're actually hydrating the body more than just draining a 32-ounce
sending
glass
it all to your bladder.
Right.
Yep.
So then, so we've got chiropractic care. That's the important thing, just keep the spine moving. And then we have hydration. So what about movement?
Yeah, ergonomics. I mean, believe it or not, most of the time when let's say someone has never seen the chiropractor, they're 33 years old, they come in, they have exquisite back pain. It could be that they lifted something heavy. It could be, but it can also happen. You reach over to pick up the last sock out of the hamper. That can do it because your trunk, from your waist to the top of your head is heavy. If I asked you to pick up a broom handle, just the handle, the easy way to pick it up is just go over and pick it up in the middle. How much does that weigh? Not very. But if I said, no, I need you to pick it up within 1 inch of the end and carry it across the room to me. Well, there would be a fulcrum then, maybe 5 feet long or however long that broom handle is. You'd probably have to reinforce your thumb to carry that broom handle across the room. And that's because that 5 foot or however long the broom handle is acts as a lever, meaning it multiplies the force, right? A lever is one of the simple, if you go back to your physics class, it's one of the simple, what's the right word? Lever, a plane, one of the simple tools or the basic instruments of work. How do we multiply, the wheel, the inclined plane, and the lever? Learn that in physics. I don't know why I can't think of what it is, but let's call it a simple tool or a simple work.
So we've got chiropractic care. You'll think about it in a minute. So we have chiropractic care, we have hydration, and then movement. Like Leo and I, we just took a 2 mile walk, just a stroll up until we have a lane that's next to us. And that is helping our spine. This is the movement.
Yeah.
We have so many patients that come in. They might be our age or a little bit older or even younger. We've had them come in where they sit all the time and they don't move. And sometimes before they go back and see Leo, then I'll work with them out front, just moving their body, just swinging their leg, or just a squat. I mean, how important is the strength of your legs? That's something that's so important, that you want to be able to constantly keep that strength in your legs. So what would be another thing? You've got the chiropractic care, then you've got the hydration, the movement,
the proper ergonomics and movement. Yeah.
Mm-hmm. And then strength training, weight training.
Any kind of weight-bearing exercise, that's good for the entire body. When we sent men and women to the moon back in the 60s for the first time, we monitored every aspect of their physiology, if you will. And of course, we monitored their urine. What we found is that when those folks got into weightlessness, particularly when they were bouncing around on the moon, we were finding this byproduct of bone degradation in their urine called hydroxyproline. It's one of the things that, it's like the body has a wisdom, and outside of the gravitational force of the earth, it's like the body's central nervous system simply said, well, if we're going to be in weightlessness, we don't need this much bone density. And it, believe it or not, began to break down bone almost immediately. Of course, when they landed, I think they landed like off the coast of Texas or what have you. As soon as they got, and they needed time to recover from their time and space. As soon as they got back into the Earth's gravitational field, what they were used to, their body began to remineralize or re-strengthen bones. So weight-bearing exercise, almost anything from walking all the way up to, if grandma started doing squats, and we are both grandparents, but I mean, imagine you bring in an 85-year-old female who's never exercised in her life. She has osteopenia, or male, male or female, not picking on anybody. And they began to, with of course proper coaching, let's say they did no weight squats with even just a broom handle. It doesn't even have to be a 45-pound Olympic bar, just the broom handle. And they're got it across their shoulders and they're doing a squat. But what are they doing? They're doing weight-bearing exercise. We would be able to show in very short amount of time that bone density, particularly in their hips and thighs, was on the rise just from that exercise. So yeah, I would say regular chiropractic, proper hydration, proper ergonomics. And like I said earlier, it's usually the simple thing where we get sloppy. Most of us would be real careful if we're going to pick up like an arc welder, but we're sloppy when it's something very light. And remember, your trunk, 2.5 or so feet long, that lever effect, you bend over from their waist, that trunk is way heavier than you realize when you include the lever effect. And then fourthly, weight-bearing exercise. Almost any weight-bearing exercise improves bone strength and health.
I'm glad he brought up grandma, because we do get patients that come in. I am a grandma, but we do get patients that come in that have, they think, oh no, Sheila, I'm 65 and I can't start lifting weights. We're 61. And about 3 years ago, I was in the best shape ever. But then, you know what? Life happened and, I have all kinds of different excuses, but I stopped lifting. So getting back into the gym now, I'm like, at first I was somewhat embarrassed by how little I could lift and get exhausted. But the more that I do it, the more that I'm getting stronger, right? So I went in there and I'm like, oh man, before I was able to do, 20 pound, 25 pound curls, and to pick up the 10 pound was kind of humiliating. But you know what? Now I'm picking up the 15 pounds because it's gradual. So it's something that you don't want to do, go in too hard, too fast. So now we've talked about the different ways that we could prevent. And listen, with this YouTube video, you can actually leave a comment, and we're going to be, if you have any questions, you can definitely leave a comment there, a question there, and we will answer that. And while you're doing that, hey, go ahead and hit that like and subscribe button, because we're new at this and we could use all the help we can get. So now we're going to go through each episode each video is going to go through the different types of injuries, the disc disease. But as a whole, let's say that you have been diagnosed with degenerative disc disease. So I know you may not be in our area. You may be in Alaska or in another country. So if they are not in our area, what is something that you would advise someone? They've just been diagnosed with degenerative disc disease and they're thinking, well, I guess I'm going to have surgery. So what are something that you would advise them on that?
So to answer that question, there is, if the peak incidence of disc injury, that would be the first acute flare that ever strikes a person, the immobilizing, oh my gosh, I can't even reach down and tie my shoes, is between age 20 and 40. So the first thing I would advise them to do is find a chiropractor who either mentions on their website or maybe a referral. There's a technique called flexion distraction technique. It's often referred to in the profession as FND, developed by Dr. James Cox, who was a chiropractor, and he suffered from low back pain himself, and he brought this particular technique to the profession. And it is just what it sounds like. It's a table that the patient lays on prone. It is a very gentle technique. I think the part of the population that has never seen or doesn't know about chiropractic, particularly that group, thinks that the only techniques available include, the doctor of chiropractic jumping on their low back, or I've heard it, described so many ways. Go ahead and give me the start the motorcycle version, doc, and I'll say start the motorcycle. But they're generally referring to